Hi, so I'm going to talk a little bit about a lot of things. For the stomach, I would advise not watching, for the stomach, for this video, I would advise not watching it if you had a weak stomach, because some of the things can be a little bit, you'll see. Okay, so first we're going to talk about fistulas, and we know what a fistula is, right? So a fistula is a hole, it's an abnormal opening between two hollow organs, okay? So, like, basically, if you were to, like, have, if you could picture the, the bladder and the rectum in like a man, right? So there would be a there so like the other end of the bladder is the back end of the bladder is the front end of the rectum, right? So there would be a hole in between there, and that can be really dangerous because feces could go through, and yeah, it's really nothing's good about it, and it's classified as simple or complex. And so fever and abdominal pain are probably the most common symptoms, and they're the most common indicators. But it does vary on location. So again, it's between any two hollow organs, and it's an abnormal tract. So we need to maintain fluid and electrolyte balance. That's really, really important. We need to control infection, and we need to protect the surrounding skin. Okay, so most heal spontaneously, but you need to do a lot to help them go through the process of healing. So next is diverticulosis and diverticulitis. So diverticula are like outpouching mucosa, right? And they develop in the colon. And diverticulitis is the inflammation of the diverticula, right? So that can cause perforation or abscess or fistula or bleeding. And the cause of diverticuli is unknown, but we encourage our patients to have a lot of fiber because that can help. A lot of times they have lack of dietary fiber with diverticuli. So if there are any symptoms, they are abdominal pain, bloating, passing gas, and bowel changes. So again, we want to increase their fiber and decrease their fat, less red meat, and that decreases their risk of exacerbation of the disease. And then hernias, we already talked about a little bit, but basically it's protrusion of an organ through an abnormal opening. So there's inguinal, which is like the spermatic cord or the round ligament. There's femoral, and there's ventral, which occurs, the ventral can occur in multiple surgeries. And if the hernia becomes severe or strangulated, vomiting, cramping, distension, whatever, surgery is required, like immediately. Okay, so let's just talk about hemorrhoids really quick. So hemorrhoids are the dilated veins, internal or external. So internal would be above the internal sphincter, and the external ones would be external. So symptoms are bleeding while you're defecating, and a lot of itching is very common. So, oh, and foul, I guess, yeah, well, so there could be prolapse, okay? And the surgery is required if there's excessive bleeding, but it usually does not need surgery. So a nursing intervention is to prevent constipation and avoid prolonged standing or sitting because these can develop into varicose veins, which are hemorrhoids, and you don't want those. So the next is an anal fissure, which is basically a skin ulcer or like crack in the lining of the skin. It comes from trauma, infection, inflammation, and the symptoms are basically very simple: anal pain and bleeding. And then an anorectal abscess is perianal pus, like resulting from infection of the anal glands. So there's pain, swelling, could be a foul smell. It's usually tender and usually have a fever. So the drainage of the abscess is important. We need wound care, sitz baths, and we need to make sure the anal area is very clean. So anal cancer is a lot of times 80% of them are from HIV. So the initial symptom is rectal bleeding, and also pain and sensation of a mass in your rectum. And treatment depends on the size. There's like local ablation, chemoradiation, surgery. There's a bunch of different things. And make sure your patient gets Gardasil to prevent HPV, because again, HPV is a big cause of this anal cancer. And a polondial cyst, I don't know how to say that, sinus, I'm sorry, is basically a nest of hair, and it's like warm, moist, and it's hot. Yeah. So that's basically a little bit about a lot of stuff. I hope that was helpful. See you in my next video.